Good day, future nurses. So today, we are going to tackle about the activity, mobility, and exercises. But before we begin, let me first introduce ourselves. I am Jomari Owen B. Makasaet, together with Chi Templo, Carla Makasaet, Princess Hudba, Kenneth Atienza, Rihanna Gravino, Margaret Pisigan, Aldrin Pañares, Gwyneth Competente, Ann Kayla Moleta, and Mac Isidoro. Specifically, our topic for today are the nursing interventions to promote activity and exercises. So, these nursing interventions are designed to promote activity and exercise by maintaining proper body alignment, preventing complications, and facilitating functional mobility. So the first nursing interventions po is what we called ADL or activities of daily living. So it refers to the basic self-care tasks that individuals perform on a daily basis. So basically ito po yung mga bagay na ginagawa natin sa pang-araw-araw upang alagaan ang ating mga sarili, katulad ng panliligo, pagbibihis ng damit, at pagpapanatili ng kalinisan sa katawan, pagkain, at paggamit ng toilet or CR for elimination. So as nurses po, our crucial role is to assist the patient or encourage them to engage in ADLs to the best of their abilities, promoting independence and functional mobility. So the second nursing interventions po is what we call protective position. So as nurses, we always have to remember that the choice of position depends on the patient's specific needs, medical condition, and level of mobility. So the first protective position po is what we call supine back-lying position. So as we can observe in the picture, the patient is positioned on their back with the head, neck, and shoulders supported by pillows. Basically, nakahiga po ang ating patient. The feet are positioned in dorsiflexion. Toes are pointing up. To prevent foot drop, a condition where the foot hangs downward due to muscle weakness or paralysis. Second on the list is the Fowler's position. As we can see in the picture, the head of the bed is elevated, typically between 15 to 45 degrees, to allow for a semi-upright position. So this position can help improve respiratory function, facilitate swallowing, and reduce the risk of aspiration. Now, third on the list is the high Fowler's position. As we can observe in the picture, the head of the bed is elevated to 80 to 90 degrees, creating a more upright position. As we can see in the picture, para po tayong nakaupo dito. Then this position is often used to improve respiratory function, facilitate feeding, and promote better circulation. Fourth on the list is the lateral, side-lying, or sim position. So as we can see in the picture, the patient is positioned on their side, with the upper arm and leg supported by pillows. Ang ating pong katawan ay nakatagilid dito. So, this position helps prevent adduction. It is an inward movement of the shoulders and hip, which can lead to contractures and other complications.
So, dorsal recumbent, supine with knees flexed. So, dito si patient ay nakahiga, then yung mga tuhod nila is nakabend or nakataas, then yung paa naman nila ay nakabuka. Prone abdomen lying position, head turned to one side. So, dito, si patient ay nakadapa, then yung ulo nila ay nakaturned out to the side. Then, knee chest or genopectoral, the trunk is perpendicular to the legs. So, dito naman, sa madaling sabi, si patient ay nakatuwad. So, mostly, ang position na to is used for gynecological examination or surgery. So, second in nursing interventions to promote activity and exercise is protective positions. So, first is Trundle Burge position. The bed is tilted with the head downward. This position is not often used because it causes blood to rise and causes hypotension on return to the supine position. So, here naman is nakataas yung bed kumbaga. Hindi siya nagagamit mostly kasi nga this position is used to redirect blood from the lower extremities into the central circulation. Then second is modified Trundle Burge. Supine with the lower extremities elevated at 45 degrees. So here naman, ang patient ay nakahiga flatly, then with their head level to their body and their legs are passively raised. Then reverse Trundle Burge position, entire bed is tilted with feet downward. This prevents gastric reflux. So here naman, ang patient is placed in supine position and naka-incline ng 30 degrees angle para ang head is higher than the pelvis and the leg is lower than hip.
These protective devices are like special tools that help keep our body safe and comfortable. Hand rolls and rubber balls are used to prevent a condition called claw hand deformity, which can happen when the muscles in the hand get tight and bend the fingers inwards. The trochanter roll is like a cushion placed around the hips and thighs to stop them from turning outwards too much, while the footboard and boot spins are used to stop a problem called foot drop, where the foot hangs down and can lift up properly. So these devices are like superheroes for our bodies, keeping them in good shape and helping us move better.
These are the purpose of exercise. Number 1, to maintain body alignment. This exercise help keep the body in proper alignment and posture, which can prevent strain our muscles and joints. Number 2, to improve muscle strength. By engaging in exercises that target specific muscle groups, individuals can increase their muscle strength over time. Number 3, to improve muscle tone. This involves engaging in exercises that help firm and tighten muscles, resulting in a more defined and toned appearance. Number 4, to improve circulation. This exercise can help enhance blood flow throughout the body, which can improve overall health and function of organs and tissues. Number 5, to relieve muscle spasm. Specific exercise can help relax and release muscle spasms, reducing discomfort and promoting better muscle function. And number 6, to relieve pain. Through targeted exercise, individuals can alleviate pain in specific areas of the body, improving overall comfort and mobility. Number 7, to prevent or correct contracture deformities. Certain exercise can help prevent or correct contracture deformities, which are abnormal shortening of muscles that can lead to restricted movement. Number 8, to promote a sense of well-being. Engaging in regular exercises can release endorphins, improving mood and overall sense of well-being. Additionally, physical activity can boost self-esteem and confidence.
Types of exercises. Active range of motion done by the client without assistance to increase muscle strength. For example, include stretching, bending, and rotating limbs or joints without external help. Passive range of motion done for the client by healthcare providers without assistance from the patient will not preserve muscle mass or bone mineralization because there is no voluntary contraction, lightening or muscle or tension on bones. For examples, include gently moving a patient's limbs through flexion, extension, abduction, adduction, and rotation. Active resistive range of motion done by the client against a weight or force, pulling or pushing against an opposing force. Examples include resistance training using weights, resistant bands, or isometric exercises where the patient pushes or pulls against an immovable object under the guidance of the nurse.
The another type of exercises are active assistive ROM, done by with assistance from the nurse, encourage normal muscle function while the nurse supports the distal joints, the stronger arm and leg to the weaker arm. And active assistive range of motion or ROM entails patients actively moving a joint with partial aid from a external force or device like a caregiver or therapist. This method is applied when patients can move the joint to some extent but need assistance to complete the full range of motion. For instance, individuals recovering from a stroke might utilize their unaffected limb to assist in moving the affected limb. So the next one is isotonic. Involves change in muscle, length, and tension. Example, walking, running, performing ADL. Isotonic exercise refers to physical activity in which muscles contract and relax while the length of the muscle changes, resulting in movement at a joint. This type of exercise involves constant tension on the muscle throughout the range of motion. And the last one is isometric. Involves change in muscle tensions, only alternate tension and relaxation of group of muscles while keeping the part in a fixed position to maintain muscle strength when a joint is immobilized. Full patient cooperation is required. Also, isometric motion occurs when muscles contract without changing length or causing movement at the joint. In this type of exercise, like pushing against an immovable object or holding a static position, the muscle generates tension but remain in fixed position. Isometric exercises, unlike isotonic exercises such as weightlifting, walking, don't involve muscle lengthening or shortening. Instead, they focus solely on maintaining muscle tension, which can improve strength, stability, and endurance.
Definition of terms. First is mobility. This means being able to move around easily. When you're mobile, you can walk, run, or move without any problems. Next is immobility. This is the opposite of mobility. It means you can't move around easily. This could be because of an injury, illness, or other reasons. 3 is bed rest. This is when a person is told to stay in bed and not move around much. It's often used as a treatment for certain medical conditions. 4 is disuse atrophy. This happens when your muscles shrink or weaken because you're not using them enough. It can happen if you're not moving around or exercising enough. 5th is hypostatic pneumonia. This is a type of pneumonia that can develop if you're lying in bed for a long time and not moving around. It's caused by buildup of fluid and mucus in the lungs.
Joint contracture is an abnormal and possibly permanent condition characterized by fixation of a joint. Joint contracture is a joint gets stuck in one position and might not move like it should. Range of motion or room is the maximum amount of available at a joint in one of the three planes of the body, like sagittal, transverse, or frontal. This is how much a joint can move in different directions, like bending your knee or moving your arm up and down. Gait describes a particular manner or style of walking. This just means how someone walks. It's like their style or way of walking. Exercise is physical activity for conditioning the body, improving health, and maintaining fitness. This is doing physical activities like running, biking, or lifting weights to stay healthy and fit. Activity tolerance is a type and amount of exercise or work that a person is able to perform without undue exertion or possible injury. It's about how much exercise or work someone can handle without getting too tired or hurt. It's different for everyone.
Client from bed to wheelchair. Transferring a person from a bed to wheelchair. This is a common procedure in healthcare settings, especially for individuals who have difficulty walking or standing for extended periods. The transfer typically involves assisting the person to sit up on the edge of the bed, helping them stand if they are able, and then guiding them into the wheelchair. It is important to perform this transfer safely to prevent any injuries to the person being transferred as well as to the caregivers assisting with the transfer. Transforming the client from bed to stretcher. It refers to the process of moving a patient or individual from a bed into a stretcher. So this transfer often necessary when a patient needs to be transported within a healthcare facility such as from hospital room to a diagnostic area or operating room. The procedures typically involves assisting the patient to sit up or roll into the stretcher, ensuring they are properly positioned and secured for transport. It is important to perform this transfer carefully to maintain the patient's safety and comfort throughout the process. So always lock wheels on bed, stretcher, or wheelchair. Unexpected movements may result to injury.
Assisting clients in ambulations. Assisting clients in ambulation refers to the act of helping individuals with their walking or movement. It has several purposes. First, to increase muscle strength and joint mobility. Assisting clients in walking helps to improve their muscle strength and the flexibility of their joint. By engaging in regular walking exercises, clients can enhance their overall physical fitness and mobility. Second, to prevent potential problem of immobility. Immobility can lead to various health issues such as muscle weakness, joint stiffness, and decreased cardiovascular fitness. Assisting clients in ambulation helps to prevent these problems by promoting movement and physical activity.
So, the third purpose of assisting client in ambulation is to increase the client's sense of independence and self-esteem. So, basically, assisting clients in ambulation with the goal of increasing their sense of independence and self-esteem helps them regain confidence and dignity. Yung way na parang nagpo-provide ka ng support and encouragement, such as verbal encouragement, nag-offer sila ng parang verbal cues na makakapag-help na mas ma-boost yung confidence nila. Parang nagko-complement ka lang sa mga simpleng ginagawa nila. Caregivers empowers client to perform tasks independently, fostering a great sense of self-worth and capability. This approach not only addresses their physical needs, pati din nagpo-promote din to ng emotional well-being and na-enhance yung overall quality ng life ng client. Next, if the client become dizzy or start to fall during ambulation, slowly gently lower him to the floor and call for help. If the client is at high risk, 2 nurses may be required to assist with ambulation. So yun nga, pag may nangyayari na dizziness or pagkahilo or a potential fall during ambulation, yung immediate response is to gently lower the client to the floor to prevent injury. And pag necessary naman, call for additional assistant. Kaya nga daw ang sabi, 2 nurses may be required to assist the ambulation. Especially kapag yung client is at higher risk for falls. And yun, yung presence ng 2 nurses may be required to safely assist the client during ambulation. And para ma-ensure din yung both safety ng client and the caregivers.